Good afternoon, and welcome to the Public Health Practice Grand Rounds for September 2009. My name is Molly Mitchell, and I'm the coordinator for the Mid-Atlantic Public Health Training Center. And on behalf of the Department of Health and Mental Hygiene and the Training Center, I'd like to welcome you to our presentation today on social marketing and public health, effective campaigns and how they work. Before we begin our presentations, I'd like to invite you to visit our website to view some of our other upcoming trainings, which include our core competency training series with Dr. Carolyn Fowler, including Achieving Outcomes Through Best Process Program Design and Evaluation on October 1st, as well as Practical Grant Writing and Logic Modeling on October 26th. We're also pleased to offer Advanced Advocacy, a skill-building training for world changers with Glenn Schneider in October, and Problem Solving for Public Health with Dr. Miriam Alexander on November 6th. For those watching online, we invite you to email questions for the presenters at any time during this broadcast to MAPHTC, which stands for Mid-Atlantic Public Health Training Center, at jhsph.edu. Also, if you are watching this online with a group, we ask you to please fill out our sign-in form so that we know how many people we're watching today so we can tell our federal funders. And with that, I'd like to go ahead and introduce our two speakers for today. Our first speaker is Dr. Douglas Evans. Douglas Evans is a professor of prevention and community health and of global health and director of the Public Health Communication and Marketing Program in the School of Public Health and Health Sciences at the George Washington University. He's currently a member of the Secretary of Health and Human Services National Advisory Committee on Health Promotion and Disease Prevention, Healthy People 2020, and is an expert panel member for the Health Marketing and Health Communication Review of the Guide to Community Prevention Services, and for the Office on National Drug Control Policy Anti-Drug Campaign. Dr. Evans currently is principal investigator on an evaluation of Text for Baby, mobile health intervention, which uses text messaging to promote adherence to prenatal care among low-income urban women. He's also PI on the Consortium to Lower Obesity in Chicago's Children 54321 Go social marketing initiative, and of a community-based obesity prevention program in the Western Cape region of South Africa. He is co-investigator on the evaluation of the Parents Speak Up national campaign to promote parent-child communication about sexual activity. Dr. Evans also consults on numerous large health communication and marketing evaluation studies, including the Census 2010 marketing campaign and Population Services International's condom use promotion programs abroad. He also consults on social marketing research with the World Bank's Water and Sanitation Program and on program evaluation with Prevent Child Abuse America's National Signature Marketing Campaign. I'd also like to introduce at this time our second speaker, Terry Long. Terry Long has worked in public affairs, health communications, and social marketing for more than 30 years. For 25 years, she served as the communications director of the National Heart, Lung, and Blood Institute of the National Institutes of Health. In this capacity, she directed communications planning and media relations for NHLBI's research and education programs, as well as marketing and promotion of the Institute's many educational products for patients, the public, and health professionals. She also managed the development and implementation of mass media and public education campaigns, including the Heart Truth, NHLBI's award-winning national campaign to increase awareness about women and heart disease. Before joining NHLBI, she managed media relations, communications campaigns, and education and prevention programs for the U.S. Public Health Service, the National Institute on Alcohol Abuse and Alcoholism, and other agencies in the U.S. Department of Health and Human Services. She retired from the National Institutes of Health in 2007 and is now a consultant in health communications. So with that, I'd like to present our two speakers.
Thanks very much. Can you hear me all right? It's really a pleasure to be here today and to talk to you about social marketing. I'm going to first of all say that I think I should remember in the future to send a shorter bio, but then also say that I will be talking today about social marketing in a broad sense, what it is, how it's distinguished from health communications and from other aspects of public health, how it contributes to public health, and some of the evidence for effectiveness. So what is social marketing? People often ask that question. One confusion that's quite common these days is between social marketing and social media. So Facebook and Twitter and things like that. Social marketing is not social media. One definition that I like is from Philip Kotler and Alan Andreassen's book in 2001, that social marketing basically seeks to influence social behaviors not for the benefit of the marketer, but to benefit the target audience. So one thing I think you'll see throughout my presentation and our second speaker, Terry Long, is that social marketing really uses the techniques that are being used in commercial marketing. It uses the 4 Ps of marketing, not to benefit marketers to make profit, to sell products, and to build brands, but actually to promote healthy behaviors or socially beneficial behaviors, to benefit populations, to benefit the audience rather than the marketer. Another thing about social marketing is that people think that it's basically aimed at individuals. It's just about changing individual behavior. Well, that's an important thing that social marketing does, but it can also influence upstream factors. It can be used for public policy purposes to enhance a public health organization's value. There's some great examples of that actually outside the United States, like the New Zealand Public Health Service, which has essentially used social marketing to brand itself as a organization that's providing social benefit. And social marketing campaigns use a lot of different approaches. They use mass media, they use targeted and tailored media, for example, through social media techniques. They mobilize populations, so they build social movements to make social change. They reach out to communities. There's a solid theoretical foundation for social marketing. There are 4 main bodies of theory that support social marketing. Behavior change theory, so a good example would be social cognitive theory. Social learning can occur through modeling of socially beneficial behaviors, and I'll give you some examples of that. Message theory, how people respond to messages, how they psychologically process health information messages that are delivered to them. Exposure theory, what kind of a dose of social marketing is necessary in order to create change and how often that may need to take place. And then marketing theory, obviously, and the 4 Ps of marketing that you often hear about: price, place, promotion, and product. Marketing campaigns, social marketing campaigns, are not just communicating messages to people. Sometimes marketers talk about that as 1P marketing. That would be promotion. True social marketing campaigns use a combination of these strategies. So they may, for example, in social marketing, try to make it easier for people to engage in a behavior. That would be reducing the price. They may use different distribution channels. That would be taking advantage of place strategies. They may advertise messages, and they may, in fact, have something resembling a product in the sense that they have a package of behaviors that they're trying to promote the way you would promote a product. Or, in fact, sometimes a product itself. The social marketing of condoms, for example, is the marketing of a product, but it's being done for a public health good. There are a lot of basic social marketing strategies. I'm only going to touch on these briefly. One of the most important ones is the idea of audience segmentation. Social marketing, like other kinds of marketing, is about understanding your consumer and creating a message, creating a marketing strategy that is about the consumer. It's not about the marketer, whether you're selling toothpaste or trying to prevent smoking. It's about understanding the audience and understanding who amongst your audiences you are communicating or delivering the marketing to, and tailoring and targeting that marketing to them so that they are going to be most responsive to it, and hopefully you'll be able to change the behaviors that you're seeking to change. You have a consumer orientation, and you use multiple channels. And in social marketing, we're increasingly using techniques that have long been the province of the commercial marketing sector. A great example of that is branding. I've done a lot of work on branding over the last few years. What we have learned is that you can essentially brand healthy behaviors the way that you can brand cars and toothpaste and almost anything else. And here's an example of a branded social marketing image from the Love Life campaign, which is a South African HIV/AIDS prevention campaign that uses multiple strategies and seeks to change multiple behaviors. And Bono is one of the figures that's helping to build the Love Life brand. There have been published what are called benchmark criteria that seek to distinguish social marketing from other kinds of interventions or programmatic activities. And these 8 criteria are the ones that are most commonly, most widely adopted currently. Having a consumer orientation, which I've talked to you about already. Having some insight into your consumer. So the importance of understanding your audience through research, through doing what we often call formative research before a campaign, before a marketing effort is developed. And having clear-cut behavioral objectives. What exactly is it that we want the audience to do? If we're going to deliver a marketing effort in order to improve health, what behavior is it that hopefully science tells us would lead to better health? So if we get people not to smoke, all right, that's an important objective, but what exactly is it that we're asking them to do? Segmentation, understanding that, for example, 12 to 17-year-olds are quite different from 18 to 24-year-olds, and their motivations and their wants and needs and the things that they're looking for out of life, and therefore the kinds of marketing they're going to respond to are going to differ. Exchange. Whenever we deliver a public health program of any kind, we're actually asking for an exchange. We want our participants to actually do something, and in return they're going to get something. They're going to get better health. Well, social marketing takes that very seriously and thinks very much about the value proposition, what the marketing effort is offering and what we're asking people to give up in return. It may be their effort, their time, social arrangements, and so forth. Also the competition. Who is the competition? In anti-smoking campaigns, the competition may be the tobacco industry. In obesity prevention campaigns, it may not necessarily be the food industry, but it might be sedentary behaviors, spending time playing video games rather than going out and exercising. Always think about the competition. The methods mix. What combination of methods are we going to use to best reach this audience? You know, if it's 12 to 17-year-olds, they're spending a lot of time on social media, they're using text messaging a lot. Maybe that's a better way to reach them than TV. That's an important question. And having a theoretical foundation is obviously important. Social marketing is effective. There have been numerous reviews done recently in the past 10 years or so of the published literature on social marketing. It is effective in changing behavior. It is typically most effective in changing single choice kinds of behaviors. So fairly simple things like switching from whole milk to 1% milk. The best evidence from campaigns in social marketing has come from a few areas: tobacco control, nutrition, physical activity, HIV/AIDS. Not surprisingly, these are also fairly well-funded areas, so there's been a fair amount of research done and large-scale campaigns have been developed. There's also growing evidence that branding health behaviors, as I mentioned earlier, can contribute to behavior change, and I've done a lot of work in that area. We need a lot more rigorous research, though, in this area. We understand a fair amount about the fact that social marketing campaigns can be and often are effective, but we don't know as much as we should about exactly how they're effective, what mechanisms they're triggering. Some of the evidence of effectiveness, Leslie Snyder up at the University of Connecticut has done a lot of work in this area, published a lot of review papers recently. One important finding she's pointed out is that the effect sizes of social marketing campaigns tend not to be very large, at least when you compare them to clinical evidence. So about a 9% difference score has been observed across a wide range of campaigns that have been reviewed by Snyder and colleagues. Non-coercive campaigns, though, ones that are simply delivering health information without trying to persuade the audience to engage in a health behavior or change behavior, tend to be somewhat less effective. And the average effect size there has been about 5%. There have been some other studies here that I'm mentioning on this slide that touch on specific topics like vitamin A supplements and so forth that have shown somewhat greater effect sizes and also have been successful in getting people to maintain behaviors over a longer period of time. How does it work? Well, I think in a nutshell, social marketing works by building a positive relationship with the audience, and it increases the value of the behaviors that it's promoting. It makes those behaviors more valuable to the audience because they perceive them to have net benefit for them, or a greater net benefit than they did before the marketing campaign. They also do this by providing alternatives to unhealthy behaviors. So, a lot of this has to do with the notion of a frame of reference. So in any situation that we're in, whether you're crossing the street or surfing channels on TV or making choices in a supermarket, you have a frame of reference, a set of choices of behaviors, things that you can do. Social marketing tries to frame the healthier choices and make them seem more valuable, more attractive. And this notion of opportunity, ability, and motivation that's often used in the global social marketing sector, the idea that people have to have opportunities, they have to have the ability, and they have to be motivated to engage in healthy behaviors. Social marketing can try to touch on each of those factors. I've mentioned branding. It's an important concept because we're always in competition. If you're developing any kind of public health program, your program is in competition with something else that's going on in the environment. And again, social marketing takes that idea very seriously and tries to analyze, well, what is the competition doing to get people to engage in the behavior that we don't want them to engage in? And by developing brands that essentially synthesize and capture in a simple way the ideas, the values, the beneficial exchange that people can get from engaging in a health behavior like using a condom or eating nutritious food or exercising more, we can beat the competition. So that's an important part of social marketing as well. A quick example, focusing in on an audience, social marketing to adolescents. So they've been a major focus of a lot of recent social marketing efforts. I've written a few papers about this recently, review papers and so forth. Some adolescent behaviors like social networking can be really effective. So there's a correlation between what they're already doing and a channel that social marketing can take advantage of. And there's some advantages and both some challenges to that I'm mentioning on this slide. Moving a little bit quickly through the slides because I've got a fair amount to cover. In a recent paper I published in the journal Future of Children, we reviewed a lot of major social marketing campaigns that have been targeted to adolescents in recent years. And this is just an example of some of them. A great example that I like to talk about is the Verb Campaign, which was funded by the Centers for Disease Control in the U.S. It was focused on physical activity. They had an observational research design, but have been able to establish some important findings and show a large effect size of the Verb Campaign over the years. They used a lot of different strategies to reach kids, and I'll talk about that more in a minute. There's some other examples listed here. The Truth Campaign is another great example. The largest anti-tobacco campaign still ever worldwide. They spent over $300 million on this campaign just in the first 4 years, I believe, that it was in operation. It used a theory of behavior change modeled on social cognitive theory. Basically, the idea that if you model a non-smoking lifestyle and you demonstrate that kids who aren't smokers are independent, they can rebel against authority just like all teenagers want to do, and they can take personal control over their lives by being non-smokers, by being part of the Truth Campaign, the very things that the tobacco industry tried to take advantage of over the years, that they can get social goods, they can get benefit out of that. And so the Truth Campaign used that approach and modeled those behaviors through mass media advertising. And we found in studies that I've done that the target audience, that adolescents had very high brand identification with truth, and that brand identification was associated with less smoking, lower odds of smoking. This is just a image from the Truth Campaign, basically the idea of rebellion, that the tobacco industry is manipulating us and we're going to join a social movement against those efforts. So there's competition there, very explicit competition, and there's something to belong to, something to engage in and actually enact the behaviors that the brand, essentially rebellion, that the brand is promoting. And there's evidence that this campaign was highly effective. In an article published in the American Journal of Public Health a few years ago, exposure to the Truth Campaign was attributed to about 22% of the total decline that was observed in youth smoking during the first 3 years of that campaign. So basically, if you look at the divergence between the red and the blue lines from 99 through 2002, that difference of 1.6%, 22% of that can be attributed to truth. And that has a huge health impact. That means that about 300,000 fewer youth smokers, kids, started smoking can be attributed to truth. And you can project that out to hundreds of millions of dollars in healthcare costs and millions of life years saved. Another example, thinking about sectors in which social marketing can be implemented, is the area of healthcare. People don't often think of social marketing in the context of healthcare, but there have been efforts to change consumer behavior, healthcare consumer behavior, primarily through risk communication messages. An example of that would be screening, cancer screening, social marketing messages, and my colleague Lauren McCormick has published on that. There isn't a lot of research published on changing provider behavior. There's an older literature that has looked at this. More recently, I've been involved in some efforts to basically look at pharmaceutical marketing, and especially cases where it is perhaps manipulative and deceptive, trying to get, for example, psychiatrists to prescribe antidepressant medication for off-label purposes, and trying to use what we can learn from the pharmaceutical industry to develop counter-marketing messages aimed at physicians. I did a recent review of evidence on this topic. So what are the strategies and tactics? What are we actually doing when we do social marketing? Well, one thing that has gained a lot of prominence in the last, I'll say, 15 to 20 years is the notion of counter-marketing, that there are efforts being made by various industries, various segments of our society to market products or behaviors that may be contrary to public health. And so we need to develop techniques to essentially counteract those, work against them. So the notion of marketing against marketing that's already going on by an industry like the tobacco industry is a great example, or perhaps the pharmaceutical industry in some cases. One of the main things that we have going for us in public health is that we're the good guys. And we can use that to our advantage. I don't say that tongue-in-cheek. I'm quite serious. We have the ability to form credible arguments and to be likable. And in social marketing, I think we've, at least on some occasions, done a good job of taking advantage of that. On a theoretical level, we found that the credibility and the likability and other cognitive and affective features of social marketing messages play a big role in how people receive them and whether or not they actually engage in the behaviors that are being promoted. We use theory-based behavior change models, as I've mentioned, branding, and we use risk communication. So there are a lot of challenges in this when we're dealing with an audience like, for example, adolescents, and those are important things to think about. What are the barriers to behavior change? We develop a great campaign. We've got the best product in the world. People should buy it, right? Well, it doesn't always work like that. We're operating in an environment with a lot of pre-existing conditions, and we have to think about those in advance when we're developing our campaigns. A great example of that would be adolescents' lack of concern about health risks. They don't have any motivating personal experience. Their brains may not have developed sufficiently to actually be able to appreciate those health risks in many cases. Information overload. We're constantly bombarded. I've got a BlackBerry in here buzzing in my pocket with information that we could pay attention to. And there are a lot of health issues competing for our attention. So how does social marketing break through those barriers? Our busy lifestyles. For adolescents, then, the issue would be, how do I define the benefit to the adolescent? How are we going to create functional benefits, something they're going to get out of the behavior that we're promoting? And are my friends doing it? Is there some sort of social benefit? Why should I pay attention to it? So what's the benefit and the cost involved in this? Some basic principles of effective social marketing that have been successful in helping to overcome some of those barriers are personalizing risk data, using stories, narratives, anecdotes, bringing it home for people, using graphics, being sensitive to social norms. What are the customs, what are the norms in the culture, the community that we're trying to reach out to? Using a variety of approaches and using plain language. I was just at a conference on health literacy yesterday in DC, and that's a very important topic. Some great examples recently of the use of social networking, which, as we all know, is very big and growing. There hasn't been a lot of social networking examples yet in the health communication and marketing or social marketing arena, but recently there was an edition of the journal Cases in Public Health Communication and Marketing that's published at my university that summarize some of these. And I've mentioned a few of them here. A great example is the Verb Campaigns, verbnow.com, which allowed tweens or 9 to 13-year-olds to interact and share ideas about physical activity, and actually reached out to them using a mobile messaging strategy. And the verbnow.com campaign was part of the larger Verb campaign that I mentioned earlier. It's been published in an article by Marion Human and colleagues in 2008. It basically provided a way for the target audience to engage with the brand, to be part of it, to get into it. So kids could go onto this website and get ideas about active games. They could get tutorials from sports celebrities. They could interact. They could essentially build brand equity by being part of it, by actually getting into the brand. And as another way of engaging the audience, there was something called Verb 8372. So a few years ago, they ran ads about a cell phone that magically becomes active and leads its owner out to the park to play. And the numbers 8372 happened to spell verb on a keypad, which was shown in the advertising. And the call to action in these ads was basically for kids to go to this website and find places in their community to be active. So it was a way of using the cell phone to drive traffic to the website and continue to build that engagement in the brand. And this is just the Verb logo, which connotes movement, activity, obviously. A great campaign that is unfortunately no longer funded right now. And I wish I hadn't put these delays in here. Another initiative, one that I'm working on that was mentioned in the intro, is mobile health. So what technology do people actually use? Where are they? What place are we likely, of the 4 Ps, are we likely to actually find people today? Well, no surprise, it's on the internet, and even more so, it's on handheld devices where people who are at some socioeconomic disadvantage compared to the overall population may be more likely to actually get their online access. And this is continuing to grow. I mean, within a few years, we won't see some of the old-fashioned cell phones we have. Everybody will have a smartphone. Everybody will be able to get on the internet this way. So mobile phones, it's not news, but have tremendous potential for social marketing applications in the public health world. Trillion SMS text messages sent in 2008. I have no idea. It must be double that by now. So what is mHealth? Well, one way of thinking about mHealth is basically that it can be a connection between the medical community or the public health community and people, and a way of delivering information to them to help them make healthcare decisions, but also to deliver health information and marketing that can be used to drive their behavior towards healthier options. And there is evidence that this approach works. There have been some studies, especially in the smoking cessation area, that have shown that smoking cessation attempts and adherence can be improved through SMS messages, that adherence to diabetes treatment regimens can be improved, and that attendance at primary care appointments can be improved. So there's some evidence that this is likely to work. And a new program that I'm working on right now is called Text for Baby. So it's basically the idea that you can text baby to this number, and you can get information about prenatal care. And for the population of low-income mothers, many of whom are going to be single, this is very important information. So adherence to prenatal care guidelines could potentially be enhanced by this approach. So basically what the campaign is about is a marketing or PR outreach effort to try to encourage women to register, get them registered, and then collect data from them and provide them with text messages that provide very specific, actionable, simple to do behaviors like take your folic acid, avoid smoking, not drinking, attending your prenatal care visits, and a variety of other important nutrition and other behavioral advice. And what we're doing is essentially developing and now testing this intervention to demonstrate that it works. So the service, as I said, basically registers women, and it delivers 3 text messages per week. These messages are evidence-based. They've been developed in combination, in collaboration with researchers at the CDC. They're in English and Spanish. They're based on the stage of pregnancy. So again, place. They're tied to where you are right now, what you need to do, what to expect at the at the 15th week, at the 21st week, what to avoid, what to do. And then providing also help, access to other information as needed. And just an example of some of the messages that we're delivering. Don't forget your multivitamin. Baby spine and brain are growing now. Getting 400 micrograms of folic acid daily is key to help prevent birth defects. You can't provide a lot of information in a text message, but you can summarize key steps that someone should take. And if you deliver those in concert at the right time, our theory is that can motivate behavior. We have some in-depth evaluation plans. We've already finished focus groups that led to the development of the messaging, and now we're developing and getting ready to implement a randomized trial just before the Text for Baby interventions implemented. I'm just going to skip through this quickly. We basically did formative research. We did focus groups in English and Spanish. And we also asked some quantitative questions during these sessions so that we could both have quantitative and qualitative data. We're then doing what's called we're calling a core service evaluation, where we're doing an efficacy experiment to prove the concept that Text for Baby actually works. And we're going to, working with a large health plan, we're going to randomly assign some mothers to usual care, to the care that they're already getting, and some to get the Text for Baby messaging. And then we're going to evaluate those effects. And this is just an idea of the study design and the fact that we'll be collecting data at 4 time points, expecting some folks to drop out over time. So just in conclusion, and I know I've probably just about used up my time, social marketing works. It applies commercial marketing principles for a social benefit rather than to sell a product, for the benefit of the population or the audience rather than the benefit of the marketer. And there is a lot of evidence that it works, but we need more controlled studies, especially to figure out exactly which strategies, which techniques are most effective so that we can spend our precious public health dollars most wisely. Commercial techniques like branding are growing rapidly in the field, and we think that they have a lot of potential to improve social marketing's effectiveness down the road. New and social media are definitely growing too in this field, and social networks appear to be a valuable tool to generate exposure. An example, another project I'm working on is related to child abuse and neglect. And on Facebook, there is a fan group of something like 5 million people who are focused on the issue of child abuse and neglect. Tremendous opportunity to socially market, a fairly narrow but important issue using social networking. And social marketing and public health can compete even with relatively small budgets. I think that's really one of the keys, is that we're often up against huge competition. The tobacco industry spent something like $9 billion in advertising in 2005, I think it was. We're never going to spend a fraction of that. So we have to figure out, we have to be smarter, faster, and better. And I think that's hopefully what we're learning through the research we're doing on social marketing. And now I think you're going to hear about a really exciting campaign from Terry Long. You do that.
Well, good afternoon. It's a pleasure to talk to you today about the Heart Truth Campaign, which is an awareness campaign for women about heart disease, sponsored by the National Heart, Lung, and Blood Institute. And I'm here to talk to you about the campaign as a good example of a successful social marketing campaign. And you'll see as I talk about this, that the campaign very much follows a lot of the principles and practices that were outlined by Doug. And I'll try to bring these out as I go along and talk about it. First of all, just to sort of set the scene, I'd like to talk to you a little bit about women and heart disease in general. Heart disease actually is the #1 killer of women in America. At the beginning of the Heart Truth Campaign, most women did not know this, but that awareness level has increased dramatically, and I will talk a little bit more about that. In fact, 1 in 4 women dies of heart disease in America. And the an interesting element of all this is that about a third of women greatly underestimate their own personal risk of heart disease. There's a sort of disconnect. They fail to make a connection between the risk factors for heart disease, things like high blood cholesterol and high blood pressure and obesity and physical inactivity, diabetes and so on, and their own personal risk. They may even know that they have some of these risk factors, but still don't understand and aren't truly aware of the kind of risk that that confers to them. And in fact, that can be quite significant because having just one risk factor doubles the risk of developing heart disease, and your risk skyrockets with each additional risk factor, something that most people actually don't know. And many women are at risk. Fully 80% of midlife women have one or more of the risk factors for heart disease. So you can see this really is a considerable problem. In response to all that, in September 2002, the National Heart, Lung, and Blood Institute of NIH launched the Heart Truth Campaign. There was a lot of planning that went into this and a lot of following of those social marketing principles. Actually, at the very beginning, the government convened a meeting of experts and asked them what should be done about the issue of women and heart disease and what they felt was the best thing that the government should do to spend its own time and money in this arena. And unanimously, the conclusion was to start with an awareness campaign, to raise awareness about the whole issue of women and heart disease, and start down that road toward behavior change. So the objective of the Heart Truth, out of that grew the Heart Truth Campaign itself, with the objective of increasing awareness of heart disease as women's #1 killer and motivating women to take action to reduce their risk. You talk about audience segmentation. The audience segment that is the prime target audience for this campaign is women ages 40 to 60. And the reason for that is this is the time of life when a woman's risk of heart disease starts to rise dramatically. The overall approach, a social marketing campaign, and it does incorporate a very strong branding strategy, as Doug was talking about, and I'll show you how that all played out. The implementation strategy for the campaign is really a three-part thing. Very strong partnership development. The National Heart, Lung, and Blood Institute said from the very beginning this should not be just a government campaign and reached out to partners across many different sectors, and I will talk about that more. A strong media component, and also a strong community action component to get the messages and the programs and the materials down to the community level where women live and work. And throughout all of this, there's a very, very strong focus on women of color, especially African American and Hispanic women who are more likely to have the risk factors that lead to heart disease and are less likely to be aware. So like all good social marketing campaigns, the Heart Truth Campaign started out with a strong foundation of formative research, getting to learn more about the target audience and what works for them. We found out many interesting things through that process that helped to guide the whole planning and implementation of the campaign and in the beginning and still guide it today. One of the things we found was that it was important to leverage women's interest in their outward appearance, and women really are interested in their outward appearance, but then to focus that inward. What is happening on the inside? That is, what's happening with your heart. It was also important, we found, to give women a very strong wake-up call about their personal risk of heart disease. We needed to take a very hard-hitting approach and give women this wake-up call in a personal sort of way. And this was actually very different from the kinds of campaigns that were happening at the time. Most of them had a much softer focus. They talked about staying well, basically taking care of your heart and doing the kinds of things that would keep you happy and healthy, but they never really talked in a very dramatic and hard-hitting way about what kind of risk you had from that. Why do these things? What would happen if you didn't? And the Heart Truth Campaign took that kind of approach from the very beginning. It also, as Doug was saying, was important to personalize it and to give personal stories. The campaign very much does that and did that from the very beginning. If you look on the campaign website, you'll see the personal stories of women who are struggling with heart disease and who have the heart disease risk factors and what they're doing about it. Now, at the very beginning of the campaign, also, talk about branding and campaigns, there was a deliberate effort to create a women and heart disease brand, something that would have a powerful emotional connection with women and would lift this campaign out of the ordinary. And the thing that came out of that is the brand of the red dress. The red dress is the national symbol for women and heart disease awareness. And it's paired with a powerful theme line that says, heart disease doesn't care what you wear. It's the #1 killer of women. In other words, it's not just a man's disease. This is a woman's disease as well. We found through testing that we had a real winner on our hands with the red dress, that there was a strong appeal to a wide diversity of women. And so the materials and images of the campaign carry that brand and carry that appeal and show real women wearing red dresses, show real women of all different walks of life and different ethnicities and sizes and shapes, and show that the red dress really is for them, and this whole issue is something that's important for them to attend to. So over time, the red dress actually very quickly became the central driving force of the campaign. And it gave many, many benefits to the campaign in ways that are even beyond what I can express to you here. But the first thing it did was prompt a unique partnership with the fashion industry, a partnership between the fashion industry and the National Institutes of Health, which is definitely a first. And it also was a unique platform for many other partnerships. People were drawn to this symbol and saw the value of it and what that could mean to women and how it appealed to women, and were drawn to get involved in the campaign because of that. And it led to many national high-profile events and to tremendous media attention for the campaign. So a lot of what the campaign was about in carrying out those strategies that I mentioned is various ways of bringing the campaign and the brand to life. Through national high-profile events, through localized events, as I mentioned, bringing the red dress and its messages to the local level, and in many other ways. You'll see there one person who was very instrumental in helping the campaign was former First Lady Laura Bush. Starting in the year 2003, she became the ambassador for the Heart Truth campaign and spent a lot of time in her appearances when she would talk, going around the country, talking about heart disease as the #1 killer of women, and did many, many, many media appearances, and greatly helped the campaign gain visibility throughout the life of the campaign and throughout her administration. So that has been a very positive way of bringing the whole brand to life. She herself said she got involved in the campaign because she didn't know that heart disease was the #1 killer of women. She was very surprised to find that out, and she wanted to share that information and became very committed and involved in the topic. One of the major ways that the campaign is brought to life, and one of the major activities of the whole campaign, is the red dress collection, fashion shows. This is the result of that unique partnership with the fashion industry and the National Institutes of Health, as I mentioned. The red dress collection fashion shows have become sort of the signature event of the campaign. They take place in February, which is American Heart Month, at Fashion Week. There are 2 fashion weeks held every year. One of them is held in February. And a red dress specific fashion show to raise awareness about women and heart disease is held to open up Fashion Week in New York City, and creates a tremendous buzz on the internet and in the media and so on about the issue. What happens there is that some of America's top designers, people like Oscar de la Renta and Ralph Lauren and Vera Wang and Diane von Furstenberg, have created red dresses. They all unite on one runway, all these different designers, and celebrities wear the dresses, and a fashion show is held. So that we have had celebrities. You see the finale shots from some of the most recent shows. The celebrities who have appeared on the runway come from many different walks of life and many different ethnicities and ages and sizes. We've had Vanessa Williams, Heidi Klum, Sheryl Crow, Paula Abdul, Liza Minnelli, Eartha Kitt, and even tennis star Billie Jean King, and many, many others. So many celebrity women have lent their time and attention and effort to advancing the cause. Another way of gaining visibility has been a special national event. It's called National Wear Red Day. It takes place on the first Friday in February, again, as part of American Heart Month. It's a tremendous way to observe a special day to raise awareness. On that day, people are asked to wear red, specifically for the issue of women and heart disease, and to do educational events in their workplace and other places around the country. It's been tremendously successful. There's a lot of media attention and a lot of attention on the web. And here's some examples of people who wore red and did things in their own environment in that day and sent pictures to the campaign team. I mentioned one of the specific implementation strategies was partnerships. That cuts across a lot of different sectors, including the corporate sector. Corporate partners have been tremendously valuable to the Heart Truth campaign. There have been about 40 different corporate partnership relationships that have been developed over time. Those are valued very conservatively, I should say, at about $65 million of contributed value to the campaign. Some of that has come in the form of underwriting some of the major program activities, including the fashion show. The fashion show is sponsored by some of the corporate partners, including, as you see there, Diet Coke, also Johnson & Johnson, and Swarovski. And there are many other sponsors, including General Mills, and many of them have done other things, including in-kind contributions, such as a tremendous amount of advertising, in-store promotions and events. They have also placed the brand, the red dress symbol, on their packaging, and often have included educational messages as well. You see an example there on Honey Nut Cheerios. It's also been on the biggest brand of Cheerios, Yellow Box Cheerios, as they call it. We figured that in all there have been about 9.4 billion product placements since 2003, which has contributed tremendously to increasing awareness of the issue and the symbol. Media partnerships are another important element of the campaign. Beyond just getting media coverage for the campaign, the team sought to create deliberate partnerships with media that women attend to. Two of the earliest media partners were Glamour magazine and Woman's Day magazine, two of the biggest circulation women's magazines in the country. They have done a tremendous amount of editorial coverage and continue to do that, especially around February. Some of the other media partners as well have contributed public service advertising space and time, including Lifetime TV and events and promotions. Again, another tremendously valuable asset to the campaign. And beyond those partnerships, another leg of the campaign, as I mentioned, has been to go to seek aggressively coverage in news and entertainment media for the major events, especially for the fashion show, looking at coverage in print and broadcast and online, and again, focusing on style and fashion and women's and entertainment media, the media that women attend to a great extent. So you'll see coverage of the campaign in People magazine and many other places that women are going to in any case and receive messages about the campaign itself. Social media strategies have grown as part of the campaign, again, as a way to promote campaign products and messages and events. As the social media world grew and those channels have changed and evolved, the campaign wanted to be there on the forefront of all this and has done a great deal to try to encourage social media strategies as part of the campaign and integrate them into what we're doing. And that has grown and changed starting at about the year 2007 and every year since. We've done more and more and more to increase what we're doing in the social media arena. For example, there's been an outreach to bloggers. Bloggers who reach women, some of them were invited to attend the fashion show, and they did come and then wrote blogs about the show. There's been email marketing to partners and other groups. There's been a public service and paid banner ads on Blog Her, which is a blog that reaches many, many different women, and on other sites that women go to. There's a Facebook page about the Heart Truth. People have posted things on YouTube. There are images on Flickr. There is a Wikipedia entry on the Heart Truth. Twitter, we've used Twitter. In fact, some of the bloggers who came to the show were asked to actually do some tweets about the show, and they did that. The campaign has created some widgets that people could download, and you see the one there with Paula Abdul. It's a sort of countdown widget to National Wear Red Day, and there was also another one about helping people to observe and make behavioral change. And also outreach just to online mainstream media news sites. So you'll see there's the New York Post, one of the examples of that right there. And just general coverage on fashion sites like Budget Fashionista. So there's been a steady increase in media impressions each year of the campaign. We figure there have been about 3 billion media impressions since 2002, and many of these are in high circulation news and lifestyle and women's media. In a small study that was done of this recently by the campaign team, we found that about 70% of the reporting communicated at least one of the things that we consider to be a very key message of the campaign. So I mentioned also that community action is a very important strategy, bringing the Heart Truth into local communities. Often one of the ways we have done that is through national nonprofit partners, many of whom have a local affiliate structure. That is a way of getting the campaign action to happen at the local level. Groups like the General Federation of Women's Clubs and Hadassah, and also the American Heart Association has its own related campaign called Go Red for Women, and they have an affiliate structure that is all around the country. So these groups, with the Heart Truth sort of serving as a catalyst, have carried the message and the branding into just about every community in the country. People asked us, hospitals and other community groups said, how can we bring this to we want a little bit of this. How can we get some of the red dresses here locally? So the campaign team responded to that and set up a way that a local group like a hospital could commission a small exhibit of the red dresses, bring that to their community, and then put around it whatever they wanted. And that's been tremendously creative and successful. Things like their own fashion shows and educational workshops and health fairs and breakfasts and teas and what have you, all around the issue of the red dress and women and heart disease. The Heart Truth itself, through the campaign, through its corporate sponsors, has a much larger exhibit of the red dresses, that has a traveling exhibit that goes around to shopping malls and offers women educational materials and free screenings for heart disease risk factors. There have been about 25 roadshow events since 2004, with about 16,000 people screened for heart disease risk. Community champions, that's another way of doing this. The campaign team does sort of the trainer sessions for people who are already out there in the community doing health education work, local health educators, to have them add a component about the Heart Truth and women and heart disease to what they're already doing. And suffusing all of this is a focus on women of color, reaching out to organizations and media and communities in order to reach women of color in many different venues. We have especially worked with national groups that have local roots, groups like the National Latina Health Network and the Links Incorporated, to get them through their organizations to bring the Heart Truth to their members. There's some NHLBI-funded projects with some of these groups, and the Foundation for the National Institutes of Health doing a mini-grant program as well. So in all, and this is very conservative, we figured there'd been about 350 plus Heart Truth-sponsored local initiatives, but many, many more that people have done locally that we haven't really been able to track or keep count of. So all of this together truly is making an impact. Awareness of heart disease as the #1 killer of women has increased. In the year 2000, when it was just the very earliest planning stages of the campaign, a survey was done, and at that time about 34% of women were aware that heart disease is their #1 killer. That has increased in 2009 to 68%. And a study done by the American Heart Association showed that awareness is leading to action. They did an analysis that showed that women who are aware of it as the #1 killer are more likely to change behaviors such as physical activity and go to the doctor to find out their risk and so on. So that cascade from awareness to action is something that is happening. The awareness of the red dress symbol has increased up from 0. It didn't exist before 2003. And in 2009, 69% of women actually could recognize the red dress as the symbol of women and heart disease awareness. That was up from a previous survey done in 2005 when it was about 25%. As I said, that's up from 0 before that. Heart disease deaths are decreasing. They have decreased in American women each year from 1999 to 2006, the latest data, and that is the longest consecutive decline so far. In 2003, 1 in 3 women died of heart disease, and in 2006, it was 1 in 4 deaths in women due to heart disease. Now, the major impact for mortality really is due to improved prevention and treatment, but the combined education efforts of many groups, like the Heart Truth, with the Heart Truth serving as a catalyst, surely have played a role in some of that reduction. And even the very conservative scientists at the National Heart, Lung, and Blood Institute do believe that education has contributed to this improvement. So there's a lot more information about the campaign development and implementation and results. There was a special issue of Social Marketing Quarterly published about it last fall, and there's the reference to it. And there's a lot more information on the Heart Truth website, www.hearttruth.gov. I urge you to go to the website and look at images about the campaign signature events. The fashion shows are on there, the community action, the partners. There's a lot of links and resources and good information. Just a quick word about future directions for the campaign. We want to try to sustain and build awareness, continuing to do that via national programs and signature events like the fashion show. We want to try to refresh those, keep them exciting, and do something different. So there are some different kinds of national events in the planning stages right now. And focus even more in on behavior change is very important. Behavior change, motivating women to take action, not just to raise their awareness, but to do something about it, has been part of the campaign since the very beginning. But we're trying now to enrich that, having done recently some formative research with women about things that will motivate them to take action. We're going to try to wrap that into the campaign messages and products and strategies in the coming year. Expanding that community action is important, and some of the grant programs will be extended and expanded. Again, throughout all of this, continuing to reach women of color in everything that we do. There's some new Spanish language materials are being developed now, including a speaker's kit. You see there the new Spanish logo, and you see women from Argentina doing the Heart Truth in Argentina. There's a whole branded campaign there now. And we're continuing to nurture and expand those partnerships across all the sectors as a very key part of the campaign. And expanding the digital influence. As the social media world and the new media world change and evolve and grow, we want to be there on the forefront and take advantage of those strategies, whatever they may be, that truly are tailored to reach women in the best way possible. We're finding that they're very cost effective and they add a lot to the campaign. We need to adapt our messages for some of those media, usually making things a lot more shorter than we have, and working on that. And then throughout all of this and supporting all of this, strengthening and promoting the red dress brand, which is a key to the whole campaign. That, in a nutshell, is the Heart Truth. Oops. Anyway.
I want to thank both our speakers for a terrific presentation. And now is time for questions and answers. So we're welcoming anyone in the live audience, of course, to ask questions for either of our presenters. And of course, if you are watching online, you can email your questions into our email address at MAPHTC, which is Mid-Atlantic Public Health Training Center, at JHSPH, Johns Hopkins School of Public Health.edu. So why don't we start? If anybody has questions here.
Dr. Evans, you spoke about the Verb Campaign and how that's kind of, it's not existing anymore, and some campaigns lose funding. So can you speak to the retention time of campaigns and people and how they kind of continue that behavior change, even though the campaign's finished or it's long gone? To speak to the retention time.
Sure. You can hear me okay? Yeah, I mean, the Verb Campaign, for example, was funded for 5 years, ended in 2006. In partial answer, I think, to your question, I mean, the Verb Campaign has continued to get a lot of citation in the academic literature. The Verb website, which was still up until pretty recently, continued to get large numbers of hits. Verb materials were being used by community-based groups. So the campaign did live on after its funding ended. But I think your question is more about whether there are long-term effects of campaigns. And one of the comments I made earlier was that there's been research now that shows that single-time behaviors, or things that simply involve making one switch, and then you've adopted the behavior, like 1% milk, are the ones that are both the easiest to change, have the largest effect sizes, and tend to be maintained to the longest period of time. More complex behaviors that require more maintenance kinds of activities, and I would put physical activity in that category, tend to be harder to maintain. And so once the marketing goes away, while I don't have statistical evidence to show you on this, my expectation would be that those behaviors would tend to tail off more quickly than, say, somebody who had adopted 1% milk.
I'm wondering, Dr. Evans, if you could speak to times, especially possibly when you're working with PSI in social marketing of condoms, if you could talk about times when the funding source and the disease or outcome you're trying to prevent, focusing on that isn't actually the best way to promote the product or activity. And I'm thinking about like the Verb Campaign was probably about physical activity, but instead of talking to kids about the risks of inactivity, it was about making it fun and something totally different. And so I'm thinking about this because in Cameroon, I did a little bit of research on condoms and attitudes toward them, and I found a very strong association between condoms and infidelity. And in relationships, even ones that are not going to last, people want to at least have the appearance of fidelity. You're the only one that I love, even if it's not actually the truth. And so I was thinking that possibly HIV prevention messages were not very effective in getting people to use condoms, and that family planning messages might be a better avenue. But I don't know with the stovepiping of funding these days whether it would be hard to market condoms as a family planning commodity if your funding source is PEPFAR, for
Right.
example.
Yeah, I mean, definitely the stovepiping issue is a big one because there are often mandates for how the work is going to be done. So that's an important factor. There's a lot in your question, or questions. So I guess I'll try to address one piece of it, which is the idea that one thing we've definitely found, and I think you see this in the Heart Truth campaign in particular, is that promoting benefits is really the key. I mean, you're essentially asking, when you socially market anything, whether it's condoms or, remaining a non-smoker or being physically active, you're asking people to give up something in return for something. So if you're asking people to use condoms, maybe they're, losing some enjoyment, or maybe it has a cost. Obviously, they're having to purchase them, even if they're subsidized, as they would be in Cameroon and other low-income countries. So you're asking them to give up something in return for what? What is the net benefit of that? And is that cost-benefit equation actually perceived by the audience as a good value? And then the marketing effort needs to be focused on promoting that. So I don't have an answer for you in terms of whether marketing condoms through family planning programs would be more effective than marketing it through HIV prevention. But the question would be to try to get some insight into the audience and what they perceive to be most valuable. So there may be some audiences, perhaps, some women's groups, women's audiences in Cameroon who might perceive the family planning angle to be more beneficial, whereas some men may perceive the HIV prevention message to be more beneficial. So really understanding your audience and tying the promotion to the net benefit and the value equation that you're promoting with the audience. I think that's the key. I mean, that's a broad answer, but you asked a big question, so.
I have a question about the Heart Truth campaign. When you met in the planning stages, well, it's two questions, I guess. When you met in the planning stages, you said you had groups of experts at the table sort of strategizing. Can you just talk about who was at that table and who were they talk about that. And then the other question is, from planning to implementation, what was the time frame there?
In the very beginning of the campaign, there was what we called a strategy development workshop, and it brought together, I think it was around 70 or so people, and they were experts in heart disease, women's health, communications, people that had potential partners from community groups. What had been happening, what the scene was, and what direction was needed now. And so that was the recommendation that came out of that, was to do the national campaign. From that strategy development workshop to the actual launch of the campaign, first of all, there was some time to put together what the government felt this campaign should look like, and to go out with a request for proposals and look for a contractor to help support that, and then award a contract, because a lot of this was carried out actually under a contract, not by government employees themselves, which is typical of how this thing is operated. And once the contract was awarded, it took about, I would say, 9 months or almost a year to actually launch the campaign itself. And so a lot of that time was spent doing that kind of formative research that I talked about, and then learning from that and developing the first materials that would be used to launch the campaign, as well as the partnership. The first groundwork was laid to reach out to potential partners.
Okay. We do have some questions from our online audience. And this is from Washington, from the Clark County Health Department. health agencies can utilize the Text for Baby program now, and if you know of any other programs for encouraging prenatal care.
Well, there are a lot of programs for encouraging prenatal care, and one place I would recommend going would be the CDC.gov website to see a nice review of other social marketing efforts in this area. The Text for Baby program is actually being done through a whole national set of partners who will be implementing the program, and they include everything from government agencies like the CDC to health plans like WellPoint to state governments and city governments. So absolutely.
Apparently that mic's not working.
Oh, really? So I have to.
Share this one.
So I have to start all over again? No,
No.
I'm just gonna keep on rolling here. So absolutely, Text for Baby is very interested in partnerships and working with partners to implement the program, and I'd be happy to try to connect the questioner with the right people to do that.
Okay, great. Let me get this one more in. This is a question about what the literature says in terms of how many times a message needs to be repeated in order to successfully make an impact in the consciousness of the consumer.
I know that commercial advertising has some formula for figuring that out, but I have to say I don't really know what that would be in the social marketing world. But
Well, there isn't a good answer to that question as far as I know. I mean, repetition is obviously important, but the huge variable in all of that is the salience of the message for the audience. If you repeat a message that's not particularly salient for me, you might keep knocking on my forehead and I'll never pay attention. But if the message is salient for me, I might immediately recognize it the first time and be highly attuned to it. So there's some huge variables in there. There really isn't a science that will tell you that 3 messages is enough. Repetition is good, frequency is good, intensity of message is good, and salience is even better.
And then there's a question about the general relative values assigned to the 4 Ps. Promotional strategies tend to have a greater effect on outcomes overall than pricing strategies, for example, or does it really depend on the individual campaign or marketing effort?
It depends on the marketing effort. It depends on the behavior. I mean, I'm aware of some examples recently. For example, of paying people to quit smoking, which is a very difficult thing to do. Paying people, in other words, giving people actually monetary incentives to engage in behaviors. And there's been some evidence that that is tremendously successful. If you think about the barriers that people face, so for example, the low-income women in our Text for Baby program, I mean, one of the main barriers they face is transportation to get to their prenatal care visits. Well, if through this program we can help them figure out strategies to reduce the cost, i.e. make it easier for them to go get prenatal care, they're going to be more likely to do it. That's a price strategy. On the other hand, a promotional strategy can be tremendously successful, especially when awareness is the issue. Mm-hmm. If women don't know that heart disease is a disease that they should be concerned about, then promotion is probably the most important thing to be doing. So a lot depends on where you are in the behavior change continuum, what the issue is, what the work in front of you is as to which strategy or combination of strategies needs to be used. So I seem to be giving equivocal answers here, but that's the right thing to say.
I can tell you a little bit about how in the Heart Truth that's played out, because it is true that promotion has been used, and you can see that largely to raise awareness, but with a greater focus on behavior change as a future direction for the campaign. I think the campaign is really going to look to some of the strategies that go to the local level and reach women in a more in-depth way to try to influence some of the behavior change. So that's why I said stepping up some of the local action and some of those grant programs is something that's on the drawing board.
So
a
place strategy, in other words.
A place strategy.
Yeah. Right.
Yeah, right back here.
This question could be for either of you. I guess, could you talk a little bit about how social marketing, the principles of social marketing, can be used for non-individual, non-behavior focused interventions? I think one of the pitfalls of public health that we focus on behavior in individuals and ignore the systematic structural things that influence those behaviors and make the choices, not much of choices at all in terms of health. And I know there's work that's being done with using social marketing for conflict resolution between Israel and Palestine and larger issues, getting at systematic structural things. So can you talk about how social marketing can be used to, for example, influence mobilize communities to address policy change, or social marketing messages and tactics can be used to speak directly, communicate directly to policymakers, so as to take the onus off the individual to change their behavior, but how about focus on how we can make society systematically, structurally easier to deal with?
I mean, I think there are some great examples of social marketing being used upstream, if you will. So, if downstream is individual behavior, upstream, farthest end might be public policy. We might think of it that way, or the environments in which we live. And there are some great examples of social marketing being used in that way. One big one from the 1990s was the National Cancer Institute's ASSIST program. And basically what ASSIST was all about was trying to bring about policy change, tobacco control policy change. And it used a variety of techniques like media advocacy techniques, community organizing, a concerted effort to bring tobacco control resources to bear on specific, that were at the state and local level, on specific policy changes. So for example, reducing youth access, clean indoor air laws. And we've had tremendous success. That campaign has led to the fact that this room is completely smoke-free, and every airplane that you'll ever fly on will be, and every supermarket and every place. You go back 25 years, that would have been quite different. So there's a great example, I think, of social marketing being applied upstream.
And you can see that more of a downstream program like the Heart Truth program benefits greatly from these kinds of things. So when there are policy changes about tobacco, for example, and it's easier for a woman to quit smoking, and that's wrapped up in the behavior change to reduce your heart disease risk, it absolutely does help in the behavior change component of the Heart Truth campaign. So it really helps to set the stage for what some of these downstream programs are doing.
We do have another online question. Wondering if either presenter is aware of policy and procedures that would be available to local public health agencies around the use of social media tools. We are eager to utilize Facebook, Twitter, and blogs, but the county IT department is concerned about policy and procedures for using Web 2.0. Do you know any resources?
I don't.
Can't say that I do either. I guess the best way, at least from the Heart Truth point of view, would be to look at the examples of what was done and maybe to infer some reasonable policies from that. I mean, I'm not sure that's probably the most practical way of going about it that I can think of.
I mean, one of the things that people in all marketing worry about in social marketing as well is that when you use social media, you have less control over the message. I mean, it's horizontal, people are communicating with each other. You may create a forum or an opportunity for information to be exchanged. You may have a brand, but they may do things with it that you didn't anticipate, and they almost certainly will. So I think that's one of the key issues that probably underlies most of the policies and procedures that are out there. But, my sense is that it's still pretty much Wild West when it comes to marketing, even with, I monitor a lot of the large commercial marketing, news feeds, news sources, and they're still figuring this stuff out. So if Unilever and, Nike and so forth are still figuring out how to manage social media and what their policies should be, it may take us a while in social marketing.
I think we have one right over here.
As far as more controversial but effective campaigns that might actually be able to get the message across, has there been any, efforts to try to convince, government or policy to kind of get these messages out, even though they might create a stir or anything like that? Because I know, like, for example, a more graphic message or anything, has there anything been done in that way?
I would say, certainly in this country, I would say that there has not been a lot of that. The examples that immediately come to my mind are from outside the United States. For example, in Canada, anti-tobacco social marketing efforts have been extremely graphic. And that's also been true in Europe. Condom promotion campaigns have been graphic in many ways. There's a famous ad of an umbrella inflating that's supposed to make you think of a condom that many of you may know about in Africa. So most of the examples that immediately pop into my mind are non-US, that may have to do with the nature of US politics and how that filters down to government agency policies.
Yeah. I think from government-sponsored campaigns, have been some that have been considered more controversial. I can think of some of the anti-drug abuse campaigns, for example.
That's true.
But usually those are vetted through the agencies, and there's probably a level beyond which they are not willing to go. Although, some of those campaigns actually push the edge of the envelope a little bit. When I say that the Heart Truth campaign is a little bit edgy, that's nothing in the vein of what you're talking about. It's just that it's a little bit more hard-hitting in terms of talking to women realistically about their risks and what that means to them. But there have been some that I think have been, they certainly have been controversial, but probably not to the degree that some of the other campaigns that Doug's talking about have gone to. Because there's probably a line in the sand there, and you're not going to go beyond that if it's a government campaign.
Study or research and comparing results in some of these other countries on an issue versus the same issue here in the United States. And like one I'm thinking about, and I believe it was in Australia, where it was an anti-smoking campaign, and it showed a mother and a child in a subway, and the mother automatically disappeared, and the child realized it, started crying. It was very emotional, and it was on the Today Show, actually. For instance, that, so has there been any research done to show if these more controversial ads have a greater impact?
Well, there's definitely research on what's called sensation value, the sensation value of ads. There's a reason why a lot of TV shows and advertising, even the news media now, you see a lot of quick cuts, scene changes, movement, activity. It's almost distracting if you're really paying attention to it. Well, there are psychological reasons for that. People attend more to higher sensation information in that respect, and also to sensation content if it's specific and salient to them. So, young boys might be very interested in, extreme sports or something like that. So there has been research in that respect, which is more basic research on how people respond to media imagery and media messages. But I have to be honest with you, I'm not familiar with any research that's really studied the difference between more controversial approaches to marketing and less controversial approaches. I think that would be a hard study to design, just as I sit here thinking about it.
You have any other questions? Yeah, right here.
What do you think about the value of product placement? Are people doing product placement in social marketing into like mainstream media programs?
Absolutely. The product placement has been a major part of the Heart Truth campaign, as you saw some examples of that. And I think that it has great value. And I think it's helped to create awareness of the red dress as the symbol. It's tremendously helped to boost that, as well as the issue itself. Just to think about the results of the campaign, and conservatively, we've estimated 9.4 billion product placements for the red dress and the Heart Truth messaging. It's a very integral part of the campaign. You have to be careful in doing it. You can't, there are some guidelines on the kinds of things that you would, and types of products that you would allow the logo to be placed on. Of course, you have to do it with eyes wide open, but doing that kind of partnering with corporations and using the power of those companies to get the word out, especially on their products, has been a tremendous asset to the campaign.
We have another question online from Chicago. Regarding the Red Dress campaign, one of the difficulties of working in public health versus marketing is that there's a dual needs. One, to get attention, and two, to be fully politically correct. For example, in a portion of the queer and lesbian community, the image of a dress could be very exclusionary. However, heart disease disproportionately affects lesbian women. Are there ideas about straddling that divide between heterosexist, sexist, sizist components of effective for-profit marketing and the social conscience of nonprofit public health institutions?
Well, I can tell you that as part of the Heart Truth campaign, we have made every effort to be inclusive and to assure that the red dress has wide appeal to a broad diversity of women. True, it is a dress, but the effort here was to distinguish heart disease as a woman's disease, not a man's disease, and this was an easy, graphic, symbolic, quick way to do that. But I think that the campaign is broad enough to not be exclusionary of anyone, and especially as the campaign has played out over time, we have had a wide diversity of women participate in the campaign and walk the runway, including in red pantsuits, as a matter of fact, to try to get that message that the heart disease message is for every woman.
How does social marketing work with sort of, educating people about immediate outbreaks, like for example H1N1, in terms of planning a campaign, implementing it, having the time to do that research and figuring out what your strategies and tactics will be? How do you sort of, do you find that compromises are made? And I guess what is the process when you're dealing with a problem that's more immediate as opposed to sort of an ongoing chronic issue?
I've done some work on, for example, H1N1 and reviewed literature in the area. I mean, there's sort of two directions you could go with that question. One is we can do social marketing for preparedness. We can deliver messages and create circumstances in which and provide products for people and places where they can get them to be prepared. So, I mean, when it comes to flu outbreaks and so forth, there aren't actually that many behavioral options. The best one is typically social isolation. You need to be prepared, though, to be socially isolated. You need food, water, possibly a mask, maybe the ability to work from home for an extended period of time. Most of the behavioral options are of that nature. So there's preparedness. The other piece is if there is an outbreak, if there is an event, risk communication, to actually deliver information to people in a timely way through channels that they're using and are more likely to attend to as to what they should do right now, whether or not they're prepared to deal with the outbreak that may be going on. So there's sort of the, what we can do from a marketing standpoint in advance, maybe way in advance, versus emergency or risk communication.
With the Heart Truth campaign, what were some of the insights that helped the team decide how hard-hitting to be as far as some of the messaging? Because I think you could take the approach of death and dying and the messages that will go along with that, or you can say having a more abundant and full life and the messages that will go along with that. So how did the team decide what was the balance?
It really came through the formative research and the testing that we did as part of the in the early days of the campaign. We tested concepts with women, and it was clear that women didn't know that heart disease was their number one killer. Already that's a little getting toward the more hard-hitting when you even bring up that idea, but that was something that was tremendously motivational to them. It was so new, and women said things like, why didn't someone tell me this? I needed to know this. And also that women didn't have any idea there was that disconnect between their personal risk factors and them knowing what their risk factors were and not understanding what that could mean in the way of conferring or increasing their risk of heart disease and leading to a life that potentially would be cut short by heart disease. And so most of the information out there was, and campaigns out there, were the ones that talked about positive ways of going about this. And so there is a balancing act, but we did try to make it more hard-hitting and then test that to make sure we weren't going over some unseen line so that women wouldn't turn it off, but to have that balance. And then to not only to talk to women about their risk, but then to balance that with stories of success and hope. So there's a lot in the campaign that talks about not just raising the alarm that, yes, this is a risk and that this means something to you and can impact your life, but there is something you can do about it. that heart disease can be prevented. And in fact, there's a line that that I didn't get to say this in my talk, but that is very frequently used in the campaign materials, that you can reduce your risk by as much as 82% by doing some of the heart healthy behaviors. So that's an empowering thing too. So it really actually is the more hard hitting coupled with the empowering and the encouraging.
Any more questions here? Okay. Thank you very much.